Hi, I'm Professor Paddy Dewan. I'm a paediatric urologist and surgeon who deals with constipation around the world, in fact, in dealing with kids who are born without a bottom, so the bowel doesn't necessarily reach all the way down, and that requires some major surgery with usually a very good outcome. There's another condition called Hirschsprung disease, which is where the nerves down at the lower part of the bowel aren't developed, and that usually presents in the newborn period but can present with constipation. So the important thing is to recognise that constipation is a word that does not describe a patient in detail. Just like asthma is a word that does not describe the patient in detail. And the lack of recognition of the detail can result in very serious consequences for patients with constipation. For instance, the child with the lack of nerves at the bottom end of the bowel may end up not getting the correct surgery that is definitely needed because that diagnosis has not been considered. Oh, it's just another constipated child who's soiling a bit, maybe got some behavioural changes. No, it could actually be an uncommon condition. And that one-size-fits-all attitude of constipation being the same in everybody, needing the same treatment, can in fact result in the death of children. And that happened just 2 years ago here in Victoria. So yes, constipation is usually easily managed by attending to the behaviour of the child, the food that the child eats, the bowel habit that the child has, and how much water that they consume. So attending to medication being added to soften the bowel so that they can more easily pass, but then checking that there's not something more going on by perhaps doing an abdominal x-ray, but not too many x-rays because they're not a good tool in the management of constipation. As parents, you'll be aware of what the common sense approach is to the management of your child with constipation. So if you've tried all those things, you've been to your GP and you've had some medication to assist, you've had some advice to assist, and your child is persistently constipated with those very hard, painful stools, with the abdominal pain, not eating because they're feeling full all the time, then come and see us so that we can plan for those further investigations, which may not be necessary, but at least worth considering, and we can have the discussion about the role of further investigation versus tweaking what you might already be doing with the diet, with the habit, with the medication that you're using. So yes, there are significant investigations which might need to be considered, which we can work through together to make sure we have minimal intervention with the best outcome for the care of your child who's got constipation.